Welcome back to Have More Babies. Today we're diving into something pretty relevant for a lot of parents here in Georgia. That moment, when your child gets sick, maybe takes a tumble, and your regular pediatrician's office. Already closed for the day. We've looked into some great info about after-hours pediatric care and, well, why it might be a really crucial thing for you to know about.
Oh, yeah. It's a situation that can just spike your stress levels instantly, can it?
Yeah.
Wondering where to go when your kid needs a doctor outside those standard business hours
Yeah.
can feel pretty overwhelming.
Exactly. And the first thought might be the emergency room, but these after-hours pediatric clinics, they can actually be a better first stop. They sort of bridge that gap until you can get back to your primary doctor.
Precisely. That's really their main job,
Yeah.
to offer, well, a more convenient and often, frankly, less expensive option than the ER for things that aren't, life-threatening emergencies, making sure kids get the care they need promptly, but in the right setting.
And speaking of local options, we should definitely mention Omega Pediatrics. They've got clinics in Roswell, Alpharetta, and Milton. Their hours are pretty helpful too, Monday through Friday, 11 a.m. all the way to 9 p.m. Could be a real lifesaver for working parents. You can check out everything they offer, locations and all that over at omegapediatrics.com. So let's dig into why this kind of care is, well, so needed. Every parent knows that feeling, right? A sick kid just throws everything into chaos, the worry, the disruption.
Absolutely. And the thing with kids' illnesses is how fast symptoms can show up or get worse. One minute they seem fine, the next they've got a high fever or something else concerning starts. That need for quick medical attention, often exactly when the regular places are shut, really highlights why after-hours care is so vital.
Okay, so we're talking about getting medical help in the evenings, on weekends, basically outside that typical doctor's office schedule.
That's the core of it. And it's interesting, some places, like Omega Pediatrics we mentioned, can actually be your child's main doctor too. They can handle the regular checkups, the well-child visits, and those unexpected sick visits.
Oh, that's a really good point. Getting routine checkups done after hours. I mean, personally, trying to squeeze those into a workday always felt like, well, a major scheduling headache.
It's such a common struggle, isn't it? The big plus of after-hours well-child visits is parents don't have to use up their leave time. And kids don't miss out on school, which is also important.
Right. And those well-child visits, they're so important, even if your child seems perfectly healthy. Why are they such a big deal in pediatric care?
Well, they cover several really crucial areas. First off, there's preventive care. That's huge. This is when kids get their scheduled shots, immunizations. Protects them against a lot of nasty stuff. It's also the time for important chats about things like good nutrition, safety at home, on the playground.
That proactive stuff is key for their future health. What else happens at these visits?
Second is monitoring their growth and development. Pediatricians track how they're growing physically, check if they're hitting those developmental milestones. They also look at learning aptitude, maybe spot any potential issues early on. It gives a really good overall picture.
And I guess it's also a time parents can bring up worries about, say, behavior stuff.
Exactly. Behavioral concerns are definitely part of it. Parents can talk about sleep habits, eating, social skills, anything that's on their mind, really.
Yeah.
Concerns about how they're interacting, maybe their mood. It's always smart for parents to maybe jot down questions beforehand, make the most of that time.
That's really good advice. And it's not just clinical stuff, is it? It's about building that relationship, too. Doctor, kid, parent.
Precisely. Having those regular well-child visits helps build trust. Good communication between everyone involved in the child's care. It helps everyone understand the child better, their specific needs, promotes their overall well-being physically and emotionally, too.
Okay, so that's well childcare. Now, what about those times when things go sideways, unexpectedly? Like, picture this. It's Tuesday night, your child suddenly feels sick, starts throwing up, has a fever. The immediate thought is often, do we need the ER?
Yeah, that's a classic scenario and totally stressful, I get it. But in many cases like that, an after-hours pediatric clinic can provide the care that's needed right then. For those urgent things that aren't, immediate emergencies, it could mean avoiding a hospital trip altogether.
Wow, that alone would be a huge relief for so many families.
It really is. And actually, the American Academy of Pediatrics points out that having same-day sick visits with a pediatrician cuts down wait time significantly. Plus, it provides that crucial continuity of care. You're seeing someone who specializes in kids' health.
Right. So in an after-hours clinic, your child probably gets more focused attention than they might in a super busy ER waiting room.
Absolutely. The whole environment is geared towards kids, and the main goal is to deal with those acute illnesses and minor injuries efficiently.
Okay, so what kinds of things are typically treated in these places? Our info gave some good examples.
Yeah, things like allergic reactions, maybe hives, some trouble breathing, asthma acting up, needing breathing treatments, even cuts, lacerations that might need stitches where you're also maybe a bit worried about a possible fracture underneath.
Okay, yeah, those definitely sound like things you'd want looked at quickly. What else?
Follow-up care after an ER visit is common too, like getting stitches taken out or bandages changed. They can also do quick tests like a strep swab, address worries about, say, a diabetic child's sugar levels, or evaluate a fever over 103 in kids older than 6 months, and deal with things like nausea, vomiting, or diarrhea if it's been going on for a couple of days.
That covers a lot of common kid issues. So if you're a parent thinking about using one of these facilities, what should you look for? Because like you said, they're not all the same.
That's a really key point. You want to make sure it's truly focused on pediatric care for those non-emergency things, fever, flu, rashes, bumps, and bruises. There are basically 6 main things to keep an eye out for.
Okay, let's break those down. First up is pediatric specializations. What does that mean practically?
It means the place is staffed by board-certified pediatricians or other healthcare folks with specific, deep training in treating kids. A pediatrician focuses only on kids, from newborns right through their teens up to 21 sometimes. That's different from a family doctor or GP who sees everyone.
So they really know the ins and outs of kid-specific health problems.
Exactly. Their training prepares them for all the nuances of childhood illnesses. And another big plus is their knowledge of medications for kids, choosing the right drug, the right dose, how to give antibiotics safely. They think about how treatments affect a growing body. They're also good at making it less stressful for the child to take the medicine.
That specialized knowledge does sound crucial. Okay, what's number two?
Shorter waiting times and convenience. We've touched on this, but kids don't get sick on a 9 to 5 schedule, right? So look for a place with evening hours, weekend hours, maybe even holidays. And if they offer telehealth, virtual visits, that's another huge convenience booster, especially for late night worries.
That access would make such a difference when you're dealing with a sick child at weird hours. What's third?
Kid-friendly facilities. This might sound small, but it really affects the child's experience. Think about exam rooms with equipment that's actually the right size for kids, smaller thermometers, blood pressure cuffs. Also having kid-sized things like walking boots or splints if needed, that shows they're prepared.
And I bet a welcoming environment makes a big difference for a scared or anxious kid.
Oh, absolutely. And many pediatric places use what's called gentle imaging guidelines, basically much lower radiation doses for x-rays compared to general hospitals. Plus, the staff are trained in ways to keep kids calm, make things less scary, like during blood tests. Honestly, it's just a less traumatic vibe than a busy ER waiting room, and less exposure to other sick people, too.
That sounds much better for a child who's not feeling well. What's the fourth point?
An in-house pharmacy. This is a huge convenience factor. If the clinic can give you common kids' prescriptions right there, it saves you that extra stop at the pharmacy when you're already stressed and just want to get home.
Definitely. One less thing to worry about. How about the cost side of things? Always a concern.
Right. That brings us to number 5, affordable pediatric care. For most of these non-emergency issues we're talking about, going to a pediatric urgent care type place is usually less expensive than an ER visit. But, and this is critical, the ER is still the place for severe pain or anything life-threatening, no question.
Good distinction. Okay, and the last characteristic.
Closer communication. Ideally, maybe your after-hours pediatrician is also your child's main doctor. That's a big advantage because they really know your child's health history inside and out. That familiarity can mean quicker, better treatment when something urgent comes up. Plus, the child is often more comfortable in a familiar place with doctors they know. They might talk more openly about symptoms, which helps get the diagnosis right and tailor the treatment better.
Those are all really solid points for parents to think about. And it loops us back nicely to Omega Pediatrics, who we mentioned earlier. Based on what you've described, they seem like a really valuable local option for after-hours care in the Roswell, Alpharetta, and Milton areas here in Georgia.
You really do seem to tick those boxes. Their late hours till 9 p.m., that's a big help. And offering telemedicine adds another layer of accessibility.
So yeah, if you're in the Georgia area, specifically Roswell, Alpharetta, or Milton, and you need after-hours care for your child, definitely check out omegapediatrics.com. You can see all their services, figure out how to book an appointment. It really sounds like a great resource for families right here.
So just to wrap that up, after-hours pediatric care is, well, it's a really valuable and convenient thing. It tackles those non-emergency health issues that just happen with kids. You get specialized care, usually faster wait times, and a much nicer kid-focused environment.
Exactly. And hopefully knowing about these options helps you feel a bit more prepared, maybe a little less stressed when those sick days inevitably pop up. Choosing the right care can really lead to better outcomes and, honestly, just more peace of mind for you.
Which leads to maybe a final thought for you to consider. How might knowing you have accessible after-hours pediatric options change the way you handle those unexpected illnesses with your kids? It's worth looking into what's available in your own community.
Absolutely. And hey, if you found this chat helpful, please give this video a like, subscribe to our channel for more discussions like this, and maybe share it with other parents you think might benefit.
Goodbye for now.
Thanks so much for tuning in.